Eugeria Live, brought to you by Griswold Home Care. Eugeria is a Greek word meaning health of body and mind in aging individuals. Eugeria Live is a weekly show celebrating the heroes that contribute to the Eugeria of our elderly and disabled population. Now joining us in the studio are your hosts, John Butler and Brad Culp. Good afternoon. This is Brad Culp. This is another edition of Eugeria Live. Thanks for tuning in today. I've got John Butler with me this afternoon. Good afternoon, John. How are you?
I'm good. It's good to see everybody.
And we also have with us Robert Perez. Robert is the general manager for Atlanta for Vitas Healthcare, and we've been doing a lot of great work together in the past year or so, and we're thrilled to have Robert with us this afternoon. John, I'm going to let you further introduce Robert and ask the first question.
Thank you, Brad, and thank you, Robert, so much for being with us. I have been so pleased with the relationship that we have been working with Vitas for some time. And one of the things that really has drawn me to appreciate and enjoy the working relationship we have with Vitas is their focus on veterans. And they have a great team. We feel like that it's a great opportunity for us to really serve both their clients and our clients more and more effectively as we work on this partnership. So Robert, thank you for joining us today. I want to ask you to start with, what do you see as the biggest change in the way you do business, how you serve your families due to the COVID virus that everyone's thinking about all these days?
Sure. Well, thanks, John and Brad. I appreciate you letting me join your conversation here. Well, it's certainly been a challenging year. I would say earlier in the year, the biggest challenge was simply trying to determine what was the right thing to do, what were we dealing with. There was a lot of information constantly changing, coming out from media sources, from the CDC, from one of our own organizations. So just getting everyone on the same page about what we're dealing with and how to address it safely while taking care of our patients' needs seemed to be the most challenging factor. It seems like several months into it, we've settled into what I would describe as a new normal. We're not able to get the equipment that we need, the protective gear that we need, and we've had several rounds of education with our team to make sure that they are using that equipment appropriately so that they feel safe and comfortable taking care of our patients.
So to that point, do you knowingly take on COVID positive clients?
Sure, absolutely. We see them, unfortunately, on a fairly regular basis, largely coming out of hospitals, but it's important that we understand what their status is, when they've been tested, are they showing symptoms, so that we can make sure that we're able to take care of their needs first and foremost, but also prepare our team with the proper equipment to care for them and to instruct their caregivers in the home of what to expect and how to deal with this in a manner that's safe and effective for everyone.
And is that your experience, that your staff, as they go into the home of a COVID positive patient, are comfortable and confident in the care that they're going to be able to deliver and in their own safety?
Sure. Well, there's certainly always going to be anxiety there. I think even with the best of training and the best awareness about what to do and having the gear to use it doesn't eliminate the anxiety, knowing that you're going into a very infectious situation. But we feel comfortable with the training and equipment that we have, that we are prepared and able to do this. But certainly there's no elimination of that anxiety. But we try to deal with it on a fairly regular basis. We hold open conference calls with our medical director on a regular basis and just invite everyone to talk about it, to express their concerns, their anxiety, answer questions, and we feel that's been very helpful. But honestly, I just don't think that anxiety ever goes away, but we've worked very hard to deal with that and just try and move forward and focus on our patient care.
I've noticed ever since I've been in this industry, which has been some time, there has always been some confusion between palliative care and hospice care. Can you just briefly describe when is a person appropriate for palliative and when is a person appropriate for hospice, and when do you recommend one versus the other?
Sure. Well, there's certainly some similarities between hospice and palliative care. That the best description I can come up with is that both palliative care and hospice are focused on comfort and symptom management. The biggest difference between the two in terms of eligibility is that in palliative care, you don't necessarily have to have a terminal diagnosis in order to qualify and receive palliative care services. Even though the focus is the same in terms of keeping the patient comfortable, you are allowed under palliative care to continue getting ongoing services and treatments to cure your ailments. Hospice is more narrowly focused. Think of it as a small section of palliative care. All hospice is palliative care, but palliative care is not necessarily hospice. So hospice is a small subset of palliative care where we're still focused on comfort. But during this time, we recognize that the physician has certified that the patient does have a life-limiting illness, by definition, 6 months or less. So we're really focused almost exclusively on keeping the patient comfortable. Versus palliative care, we're focused on keeping you comfortable, but you can still get services that are going to cure, for example, cancer, or take care of your lung disease, etc.
Following on that question, what can a family expect when they come to Vitas for palliative care?
A lot of our time for palliative care services really spent talking to the patient, talking to the family about where their disease process is. What are their options? We spend a lot of time on what we call care planning. So what are the options that you've talked about with your specialist? During your last hospital visit, what were the services that were discussed with you, and how do you feel about that? And really helping the family plan for what is the next step and what are their options. You know, one of the benefits is really just having that time with the physician. And the way I explain it to my friends and family and other individuals that I talk to is this. When all of us go into a physician's office for just a normal routine visit, we may get 5, 10, 15 minutes with the physician, but usually getting time with them is a premium. And we don't often have a list of questions that we want to go through. In palliative care, that's really what we do. We sit down with you and we help the family and the patient process the information that they've received from the hospital, from the specialist, from the primary care provider. And let's bring all that together and discuss what are your options, what are your goals, what are you trying to accomplish, and what's the best path for you that meets your needs. So we really customize that and individualize your care plan.
I know that a lot of hospice companies have the word palliative in their name, but my experience has been they really don't do palliative themselves. They farm it out. And I know you do have an actual palliative staff and team.
Mm-hmm.
What difference does that make to the family that you actually provide both hospice and palliative care?
Well, I think the biggest difference is that the continuity. So, for example, my physician, Dr. Shrika Newman, who's an amazing individual, she has experience in palliative care. She's worked with hospices before. She had her own practice prior to coming on board with us. So she understands what families go through when they're experiencing end-of-life symptoms, what families' needs are when they're discussing, advanced directives and what the options are. So having that continuity of a physician or a staff that will be there with you when you're considering palliative care, but also can be there with you when you're ready for hospice. Dr. Newman also works very closely with our medical director of hospice services and with the team physicians on hospice services, so that when the family is ready to consider hospice, she can give a good report and give all the unique nuances of that family, of their goals, what their history is, so that we can develop a more customized plan that meets their needs. So continuity of care, I think, is the biggest thing.
Given the dramatically increased usage of video health conferences, has that changed your ability to spend additional time with your patients? To be more clear, you don't have the travel time to be there face to face for every single visit. I think that people have started to get used to telehealth visits and using Zoom. And does that help you at all? Does it help you spend more time with your patients?
Absolutely, because not only more time with our patients, but we get more family members involved. If you think about pre-pandemic, most of us never even heard of the word Zoom. Or if we had a telehealth visit, it was something that we had heard about but never really experienced personally. So with telehealth, we can bring family members that are, located really anywhere on the globe, quite frankly. So the ability to sit down with the patient, with the spouse that's right by them, with children that are in California, with the grandchildren that are in Europe. And it allows us to have a very robust and rich conversation about what is best for the patient, what are their goals, and how can we work together to meet them. So it's just really an unprecedented access to family members to help us identify what their goals are so that we can work towards meeting them.
Of all the things, and there are plenty, that really make Vitas an amazing company to work with, what are you most proud of?
That's a great question. I would say the access to a higher level of care through our physicians and our nurse practitioners. Most hospices will have certainly a medical director, and they may have a part-time physician or a nurse practitioner that helps out with what we call face-to-face visits periodically. We are absolutely blessed to have 2 full-time physicians on our hospice and palliative care team, both of whom are board certified in hospice and palliative care. We also have 3 part-time physicians that have a significant amount of experience with hospice and palliative care and have worked with Vitas. We also have 2 full-time nurse practitioners and 2 part-time nurse practitioners, which is just a very rich and robust staff for any hospice company. So I'm very pleased to be offered that level of care. And that allows them to get more involved with their patients. I have physicians that will be there at the bedside to offer care to their patients in the midst of a crisis. We also have music therapy, which is just an amazing service that does wonders for families. The power of music and the power of combining that with a therapeutic approach is really a nice service that we're very proud of. I've seen it work personally, and it's really quite a sight to behold. And as you mentioned, John, earlier, our focus on veteran services. Being a veteran myself, that is certainly something that's very near and dear to my heart. And we spend a lot of time thinking about what are the unique needs of our veterans and what can we do to harness all the resources that we have within Vitas Healthcare to customize an approach for them. And that's something that we take very seriously and we're very proud of.
That's really good. I'm not sure I'm aware of any other hospice company that has full-time physicians on staff. There may be.
Most don't, to be honest with you. And it's not that they don't want to, they just simply are either too small to have a need for full-time physicians, or they just are willing or unable to make that kind of a commitment. So that's something that we're very blessed to have, because I will tell you, the ability of a physician to either pick up a phone and talk to a family, or even better, go visit them at the bedside is a powerful difference maker for these families and their loved ones.
So of all the great information you've shared with us, what would be one thing that you would want to leave our viewers with, one takeaway that they need to remember about either you or about the difference between palliative care or hospice? Just What is one takeaway?
If I knew then what I know now about hospice services, it certainly would have made a difference in my family's life. So I always try to let family members know when we talk to them that hospice is a wonderful benefit that is designed for the last 6 months of life, that is there to keep you comfortable so that you can spend the time that you have with your family in your home as a benefit that you have earned through your Medicare system that you've paid into for many, many years. Hospice as a service brings you at your bedside nurses, aides, social workers, chaplains, volunteers, physicians, nurse practitioners. We also, as a service, bring medications, equipment, supplies to you. And then hospice is not a place. We come to you as a service and take care of you for your final days, just to make sure that you're comfortable so that the time that you have is well spent with you and your loved ones.
Robert, we truly appreciate you taking the time to be with us today, and we look forward to getting together with you face-to-face soon. Thanks again.
Thank you for your time.
Eugeria Live is brought to you by Griswold Home Care. View this show again on YouTube, Facebook, LinkedIn, or our website at www.eugerialive.com. Bye-bye.